Thank you, members. This bill is a combination of a bill that I had brought to this House earlier in the year, SB 48, and AB 8, which is the Speaker Nunez's bill. We in the Senate Democratic caucus began well over a year ago to discuss how to make health care reform more than a cliche. A lot of work, a lot of time, a lot of energy with lots of people participating have gone into this. AB 8 is now the work product of that effort. At the outset, we made a number of agreements that we would participate with the Assembly and with the administration so that we were working off a common set of numbers so that as you began to move various components in and out, you had the same baseline of information so the argument would never be over the numbers but would be over the policy. You can judge for yourself how well that worked out. The governor, at the beginning of the year, proclaimed this as the year of health care. And we have to get it finished because next year is going to be the year of education reform. Let me just tell you very briefly what this bill does. It does similar things to the previous iteration, but you probably have not been studying it. It expands health care coverage to 2/3 of those who are now uninsured, about 3 million working people and their families. All children under 300% of poverty, regardless of residency status, would be covered. People with pre-existing conditions who are now denied health care would have access to either a high-risk pool or coverage in a commercial market on a guaranteed basis. All administrative costs by insurers would be capped at 85%, at 15%, requiring that 85% of your premiums go directly to health care benefits and services. Emphasis on preventative care and disease management are in there to control costs. It also gives purchasers more information about costs and quality so they can hopefully make better decisions. Financing is a shared responsibility when it comes to who pays. The bill would establish a minimum standard for employers' spending on health care bills for the employees set at 7.5% of Social Security wages. Some have said this is too high. It is a standard that we arrived at by looking at about 80% of employers in the state right now are spending on an average of 13.5%. So this is well below that standard. We also leverage about $1 billion in federal funds that this state is presently not getting. Now, we all know that the governor has said that he will veto this bill. Among other things, he said he would veto it because it lacks an individual mandate and it sets the standard of contribution on the part of employers at too high of a bar. This is an unusual step for the governor. Normally he says that he does not know, has not looked at, and therefore will not comment on any bill until it gets to his desk. So of all the exceptions he made it on this one. But there was a reason for him doing that. I fully acknowledge that his veto will be accompanied by a call for a special session. Special session will deal with the single issue of health care reform. I have agreed with the governor to participate in a special session with the idea that we would continue where we left off, not that we necessarily begin anew. The Speaker has made a similar commitment. We also recognize that incumbent upon the governor will be for him to provide us with his legislation. Many of you have been concerned over the course of the last year or so that we have been arguing with specific goals and specific legislation with written language, whereas the governor has been dealing mainly in concepts of what it should look like. Well, the special session will end the conceptual portion of the debate, and we will have real words and real pages to look at. So while the governor is fully within his responsibility and his entitlement as the chief executive to veto this bill, we want to acknowledge that we're going to continue to work with him. No one should see this as a failure, but it is really an opportunity for us to dispatch the obligation that we have as legislators to a work product that we have spent a lot of time, energy, and public money in developing. As we move into the next phase, we want to acknowledge, without laying blame with anybody else, but the long, protracted budget debate took our attention away from this, so we lost effectively 7 weeks. And we are trying to recapture in that 7 weeks what we have lost. So I respectfully ask for an aye vote on this bill as the best work product available at this time. And without question, this would be the best step forward and the finest state health care reform package anywhere in the Union. Thank you, members and Madam President. I do hasten to point out that Senator McClintock pointed out that if we didn't have committees hearing, people would be on the floor paying rapt attention to a debate. And there must be something I'm missing, because there are no committees being heard right now, yet there is a paucity of members on the floor. I'm very impressed by what Senator Runner said. He has an intimate knowledge of this information without even sitting on the Health Committee. So I would just say that for those that think we're doing last-minute theatrics, it does a great disservice to Republicans and Democrats alike who have spent hours and hours discussing this. It's pretty easy to just take a plate of the cheap seats, say this is just political theatrics. I know some of us probably said the same thing about when you held out for the budget for 7 weeks. You said it was on principle. We were wondering. But that's easy. That's what the public expects us to talk about, is what's, our differences. Let's just talk about what we have to do in common. One, we got a job to do. This has been a pretty big issue for a long time in the state. This bill is not perfect, but it is at least something for people to stand up and argue about, argue with, or even demonize. But at least no one can leave here whenever we break for the year, shortly, and then come right back. Nobody can say that we haven't done something. If you look at all the important legislation that we are voting on every minute of every day these past 2 weeks, this might rise to being more important than most. Now, I know that's in the eye of the beholder. Everybody loves their own bills. I don't consider this my bill. I don't even consider it the Speaker's bill. I think it's a work product of a lot of people spending a lot of time trying to do something that's never been done before. If we have fallen short, we pick ourselves up and we go at it again. I just ask everyone here, Republicans and Democrats alike, to recognize that when we work together, we get things done. We have one of those representative democracies that requires us to work together and debate and conclude, and oftentimes compromise. If you stand on rigid ideology, I'm not talking about moral principle now, ideology, I stand on rigid ideology, we get nothing done. And in California, what that usually means is that special interests from the right or the left spend lavish amount of special interest money putting things on the ballot to convince Californians that this is the best thing for them. So in some ways, we get what we ask for. If we want to have a diminution of the respect and importance of institutions, I'm not talking about big government versus little government, effective respect for the institutions of the founders of this country, we've got to do our jobs or let somebody else do them. So I ask in all good conscience for people just to vote the way they believe they should on this one, but recognizing that everybody's got an obligation. It's real easy for a whole body of people who share one thing in common. Everybody here's got health insurance, paid for by the taxpayers of this state. This, for us, is a theoretical argument. We are not hurting at all. We are benefiting because of the largesse of our constituents. So let's not go too high and mighty that if we just did this, that would happen. It would fix the system. We're in a very luxurious position. 40 of us in this country, in this state, have had the honor bestowed upon us by our constituents to represent them here today. And this is about the common good and the commonwealth, not ideology, not party. We will go into the next phase with the governor. Hopefully he'll provide more leadership in what he believes we need to do. But we recognize that this is something we all must do together. The legislature does best when it disposes of something proposed. I'm looking forward to a proposition in legal terms from the governor where we can join that debate. Republicans and Democrats can talk about an object out in the middle of the playing field and not on the sidelines. Ask for an aye vote.